Okay, there's 1 person, 2 person, 3 person, and then presenter. Hi everyone, I'm Krisha May, and this is my informative career speech. Have you ever been sick?
Yes.
Obviously. Maybe you had a virus, maybe you had the flu, or maybe it was just a common cold. You went to the doctor, you went to the emergency room, and while you were there, you probably met somebody who was probably wearing scrubs. Well, you didn't probably, you definitely did. You met somebody who was wearing scrubs. They took your vitals, they checked your blood pressure, they asked you to rate your pain. They asked you to rate your pain. And they just seemed genuinely concerned and caring and compassionate towards you and how you were feeling. They asked you to give a detailed description of your symptoms so that they could help make you feel better and come up with a solution to whatever problem you were having. That was a nurse. In this speech, I'm going to tell you guys about what a nurse is, what they do, how you can become a nurse, and what are the advantages and disadvantages of being a nurse. First, what is a nurse? A nurse is someone who is kind-hearted, caring, and they have a passion and a desire to help others. Usually a nurse has many job duties, their main ones being to monitor patients, oversee their care, record all of their findings and charts, whether it be on a computer, on paper, or anything like that. They treat patients and they come up with a care plan with their doctors, what they need to do to help give that patient or that resident the best quality care and give them the best possible life that they can with whatever they've been diagnosed with. Next, let's talk about the educational requirements to become a nurse. There are several different types of nurses. There's the licensed practical nurse, there's a registered nurse, and then you actually can go on to become a BSN, which is your bachelor's, or you can even get your master's in nursing. The main requirement to become a nurse just depends on what you're actually going to go for. So I want to be a registered nurse. I want to be a pediatric nurse, and the requirement for that is a 2-year nursing degree, so your associates in nursing, and then after that you're required to pass your boards or your NCLEX exams. After completing that and passing, then you would go, you would become a nurse, and then you could actually start working as an RN. Depending on what you want to do, if you want to be a pediatric nurse, a surgical nurse, a labor and delivery nurse, then there would be further trainings or courses that you would be required to take to get you there. Next, let's talk about the typical day of a nurse. So when you first arrive at your facility, whether it's a hospital, a nursing home, just anything like that, then you would go and you would get report from the previous shift. So if you're coming in the morning at 6 a.m., 7 a.m., then you would be talking to the person who was there overnight. They're going to tell you exactly what happened, what you need to do. They're going to give you a list of what your tasks are going to be for the day. What treatments you need to get, if there's any urine or specimen samples you need to retrieve, anything that you need to be, any meds that need passes, anything like that. You're going to coordinate with your patients and your doctor's schedules so you know that everybody is getting their checkups done on time. And then you're going to round and be sure that patient care is always your number one priority. The average salary for a nurse is about $69,000 a year, so that's $33 per hour, and that's according to the Bureau of Labor and Statistics. And a lot of people usually decide that they want to become a nurse based on those numbers, but it really takes a special person to be a nurse. You can't just wake up one morning and decide that you're going to be a nurse. You have to actually have the drive and the desire to want to help people and to want to make a difference. According to Stacy Driver, the best part of the job is helping people and making a difference in the lives of those around you. And the worst part of being a nurse is growing attached to those people that you're taking care of and then having to suffer the loss after they've gone. In conclusion, nurses are a vital and irreplaceable part of the medical field. They're like the backbone of hospitals and nursing homes, and without them, the world would definitely be a much worse place. Thank you, guys. Show the audience again.
1, 2, 3. I think I got me. Did I get me? Did I get me?
Yeah.
Okay.